be talking about hamstring strains. This is an extremely common soft tissue injury that you see in all kinds of activities in sports, and we're going to look at a little bit of how to handle them. So first, a little bit on the anatomy of where the hamstrings are. So you're talking about the back of your thigh from where the bony part of your hip is down to the back of the knee. So if we're looking at this not great picture that I drew, if we're looking at this as the bony part of your butt, the bony part of where you sit on your hip, going all the way down to either side of the knee. So the hamstrings are composed of two main parts, meaning that you have an outside of the leg part of the hamstring and an inside part of the leg part of the hamstring. And typically, injuries can occur on either side. They can also occur closer to the hip, or they can occur closer to the knee. So there's a large variability of where you can find those types of things. Usually, the mechanism of injury is going to be top speed running. So if you think about it, that's where you have your most forceful contraction and expansion of the muscle. And when the muscle can't handle it, that's when you're going to get a strain. The grading of the strains are going to be grades 1, 2, or 3. Grade 1 meaning it's only fraying of a few of the fibers, and for the most part, as long as there's active recovery with it, it's not going to end up being too much of a big deal. A grade 2 sprain is more of when you're going to find more bruising, more loss of range of motion, difficulty with walking, and that's going to take a little bit longer and a little bit more rehab to heal. And then if you push into your grade 3 side of things, that's more either a full thickness tear or all the way at the end of the spectrum of full thickness rupture, which is going to require more medical intervention. As far as management of the hamstring strain, usually when someone comes into the clinic and they're feeling like they were running and they feel either a pop or a tearing sensation in the back of the leg, sometimes it can just be pain that developed after the fact, after a workout. What we're going to do to determine the severity of the hamstring strain is a few things. One is to take a thorough history to see how this actually happened. Does this fit the mode of something that could be a hamstring strain, or do we need to differentiate this from other conditions? And then to determine the grade, we're looking at inspection of the area, seeing if there's any bruising. Sometimes there can be bruising, sometimes there is not bruising, but that doesn't necessarily mean that there isn't a strain present. Looking at their range of motion, how they can move. This is all going to determine, the course of action as far as what exercises we can give the person to start off with, and, asking if they've had any imaging done. For the most part, MRIs are going to give you the most information about a hamstring, but as long as it's on, the easier side of the grades, for the most part, an MRI is not going to be warranted. An MRI would be warranted if you feel like, there's something along the lines of grade 3, or if you suspect that something else is going on, and it's just kind of presenting somewhat looking like a hamstring strain. Now, what to do in the acute phase of things. We're talking within the first 7 days of the injury happening. I think the conventional wisdom for a long time was the RICE method, the rest, ice, compression, and elevation method. But actually that has been replaced by a new system called Peace and Love. And the main difference between the two, between RICE and between Peace and Love, is that RICE focuses more on passive modalities in the beginning, whereas Peace and Love focuses more on graded exposure and active recovery, as opposed to just completely resting in the initial phases. So to go through the Peace part, which is the acute part of it, so protection is the P. So you definitely, even though this is a little bit more on the active side of things as far as a recovery plan, you still need to protect the area, not push through pain, not move too much in the initial stages, respect what your body's telling you as far as what you can and can't handle. Elevation is still on there, which will help with any swelling that's going on. A little bit more of a new one is avoid anti-inflammatories. So for the most part, what the thought process is on that is that inflammation is a part of healing. So even though it might get the pain down a little bit initially, you still want inflammation to be happening as part of the healing process. Compression. So compression is still on there. So I know there's a couple products out there that give icing compression. There's any number of sleeves that are out there just to try to get compression on the area to assist with swelling. And then as far as education, so kind of like what we're doing here with educating the methods behind what the most current rehab processes are, and kind of painting the picture for the person from point A to point B, what you're going to be doing so that they have buy-in to the treatment plan. And then now, once we're past the point of the acute phase, so we're past the first 7 days, feeling a little bit better, but not quite sure what to do as far as progressing your movements, progressing your exercises, that's when the principles of the love component of the protocol come into play. So our first one is load. So making sure that we are loading the area, loading the tissue, but doing it in a way that's gradual and doing it in a way that's going to produce progression and not set the person back. The O is optimism. So in some of my blog posts, I kind of describe the words that we use with patients, so making sure that we're always keeping a positive attitude, making sure that we're guiding them through each step of the process, connecting each step of the process to the end goal, and making sure that the person is as comfortable as possible in what they're doing and knowing why they're doing what they're doing as far as how it relates to return to their sport. The V is vascularization, and I kind of pair that together with exercise because the best way to promote circulation is going to be movement, right? So the exercise component also comes into the load component. These all kind of go in together into what happens in the rehab process, where we're taking a person from their evaluation, figuring out what they can do, and gradually progressing them through stages in the process until they're able to go back to their activity. As far as the phases of rehab for hamstring specifically, I usually divide that into 3 phases. So our first phase is going to be more our piece-oriented phase, our acute phase. So we're talking about generally just seeing if they can walk, if they can pedal a bike gently, doing very gentle hip mobility and knee mobility exercises, just seeing if we can get the muscle moving a little bit in that initial stage of healing, but not pushing it too hard. Once they're able to generally move around pretty well, the gait has normalized for the most part, then we're moving into the light loading phase where we can get more into actually contracting the hamstring muscle, probably starting with a little bit more on the isometric side, meaning that you're contracting the muscle but not actually moving, and then from there working into more loaded activities as the person is able to progress in that way. Once we're able to load the joint and that is pain-free, then we're moving into our return to sport-specific activities. And what we're basically doing in the return to sport phase is gradually speeding the contraction. So in the loading phase, we're gradually getting the tolerance to loading up. Once the joint is able to be loaded, or the hamstring is able to be loaded, then in the return to sport phase, we're trying to pick up the speed to make sure that those movements that happen in a sport can be handled without a restrain happening. When determining how people move through the stages, it's easier to do that through them hitting their milestones, them hitting their goals for the phase, rather than strictly sticking to number of weeks, because many people are going to have different ranges of how they progress through, and that's okay. It's not necessarily at 2 weeks this has to happen, at 4 weeks this has to happen. Each person will kind of go through their own course, but as long as they are progressing even a little bit each week and progressing towards their milestones, we're thinking that they're heading in the right direction. If you have a hamstring strain and you're thinking that you don't really know what to do on your own, physical therapists that are in the orthopedic and the sports realm are more than equipped to handle that. If you feel like you got a little bit more something serious going on, where you feel like you can't walk, it felt like you got shot in the back of the leg, there's significant bruising, then you would maybe want to see an orthopedic first just to clear whether or not you would need an MRI. Hamstring strains are extremely treatable, but the main thing where people can mess up is doing too much too fast. And that's where physical therapists can come in to kind of guide you through that process and making sure that when you rehab the first time that you're doing it correctly and that that's the only time that you have to rehab it.